Tell me everything. How was your vacation?
It was really, really great. I mean, we ate a ton of great food, and it was so good to get away. I mean, I just relaxed the entire time. I sampled like everything, all the different restaurants. I mean, I'd never eaten food like that in my life. It was awesome.
Sounds amazing.
It was amazing. And I would totally go back. I mean, I would totally go back just to try everything.
Hold on. Do you think that person is okay? I just saw them stumble in and bump into someone, and they almost slid off the chair when they sat down. Oh my God!
Oh my God.
Let's go see if they're okay. Hey! Hey! Can you hear me? Wake up!
What's happening?
Hey!
Ma'am?
They're not responding. Hey, I need you to call 911. Tell them that someone is not responding and they're barely breathing. Hey!
Are they breathing?
Not really.
Oh my God. What's happening?
They have a pulse, but it's really weak.
What's happening? They look pale and their lips look blue. Are they having a heart attack or a stroke?
I don't know. I'm gonna do rescue breaths. I have a protective face shield, I think, in my bag. If I don't, I'm gonna use my scarf. Hey!
What's a protective face shield? What does it look like?
It's a sheet of plastic with a piece in it made of cloth that allows for air to travel through. I'm gonna use it to protect myself when I deliver the rescue breaths. Hey!
Okay, it looks like it's in here.
Hey!
They're sending an ambulance.
Thank you.
What is this? Is this like CPR?
It's kind of like CPR, but I won't do the chest compressions because they still have a pulse.
Okay.
I'm gonna tilt their head up a bit and pinch their nose before delivering the rescue breath. And I'm watching their chest and make sure that it rises after getting them.
Okay.
And then I'm gonna check their pulse.
Anything?
They're not responding, and their pulse is really weak. I wonder if they may have overdosed on something. Even if they didn't, it won't hurt to give them Narcan. I have some Narcan in my bag. Will you run and go grab it for me?
This nose spray thing?
Yeah, that's it.
Here.
Okay, I'm putting the Narcan in their nose. Can you time it for me in case I have to give a second dose?
Yep.
Okay, I gave 1 dose of Narcan and 2 additional rescue breaths.
They're still not breathing. How long does it take Narcan to work?
It can take 2 to 5 minutes for it to work, and we may have to give them a second dose.
A second dose. How long do we have to wait for that? Can't that hurt them?
It can take up to 5 minutes, and it can't hurt them, even if they're not overdosing. But this person has all the signs of an overdose. I mean, they were nodding and stumbling, and then they fell.
They're still not breathing. How long has it been since they stopped breathing? Where are the paramedics?
They're on their way.
How long has it been since we administered Narcan?
48 seconds.
Oh my God. She's breathing. What do we do?
Help me put them in the recovery position. Take this arm, put it underneath their head.
Okay.
We're going to roll them gently on their side.
Recovery position.
Recovery position. This will keep them protected from choking in case something comes up. Don't touch me while you touch me. Okay. We're just trying to help. I'm Sophia, and this is Jen. You fell down, and you weren't breathing.
Are you the one who called 911?
Yeah,
We thought
Okay.
that you were overdosing.
Okay. How long she's been down here?
like 3 minutes.
Okay.
They give
And
her
we gave you some Narcan.
Okay. Hi, I'm Newton I'm an EMT, and I'm here to help. Hi, how are you?
I can't go to jail, okay?
Oh, ma'am, you won't go to jail. I'm not a police officer. I can't arrest you.
Okay, I can't just go
Don't
to
worry,
jail.
ma'am. You're not going to get in trouble. Okay, my name is Newton. I'm an EMT. What's your name?
Evelyn?
Evelyn, how are you? Can I just check your pulse? Do you mind? Hey, Evelyn, just look at me. Just look at me right here. Okay, did you two help her at all?
We helped her with her breathing, and we
Okay.
gave her 1 dose of Narcan.
Okay. Evelyn, I'm going to strongly suggest that you come with me to the hospital.
No,
okay?
no,
Evelyn, we're going to check you out. Listen,
I can't go to jail, okay?
Evelyn, you're not going to go to jail. You just had a dose of Narcan, okay? And usually that's given if someone's had an opioid overdose, all right? And if there's any trace of that opioid in your system right now, the Narcan could wear off in about 30 to 90 minutes, and that could be put you, and your symptoms could come back, which could put you in another situation, okay? So I think if you go to the hospital, we can check you out, make sure those things don't happen to you, all right? And we can have someone monitor you, okay? Would you like to go to the hospital with me? Okay, excellent. Okay, well, I'm going to take you, I promise that I'll take care of you, all right? My colleagues are here with an ambulance and a stretcher, and we'll take care of you. So can you tell me what happened here?
I just saw someone stumble into the cafe. They were nodding their head and they collapsed to the ground. My friend and I ran over to see if they were okay, but they were barely breathing. They looked pale and their lips were blue. I tried waking them up by yelling at them first.
Okay.
And then shook their shoulders, but they didn't respond. Yeah, they didn't respond. So I just, since they didn't respond, I heard them making these gurgling sounds.
Okay.
And they were barely breathing. And then when I checked their pulse, it went weak.
Yeah.
I pointed to someone to call 911 and knew that I had to administer rescue breathing.
And that was a gentleman who was inside?
Yes,
right? Yeah.
yes,
Okay.
that gentleman. And I happened to have a protective face shield in my bag.
All right.
So I administered rescue breaths, but they didn't respond. So I was trying to figure out what it could be.
Mm-hmm.
I just recently taken a training on how to use Narcan.
Okay.
So I figured that it may be an overdose.
Okay.
I asked my friend to grab Narcan out of my bag, and I administered it.
You're welcome. You did all the right things. Your confidence in recognizing that it was an opioid overdose and your comfort in administering the Narcan was essential in saving their life.
This was the first time I ever witnessed an overdose. Is that what it normally looks like?
To me, it was a opioid overdose. You said all the red flags were there. You said that the victim was sleepy, nodding off, stumbling, not responding to verbal or physical arousal. So their face was pale, their lips were blue. You said they were making a gargling sound?
Yeah.
Yes, that's what we sometimes call the death rattle. I'm sure if you pulled back their eyelids, you would see a pinpoint pupil. The only thing that would have been different is if it was a fentanyl overdose, as opposed to some other type of opioid. With fentanyl, the overdose happens much faster. Some victims have been known to fall to the ground with a needle in their vein. So that's why it's always very important to check to make sure everything is safe before you approach someone who you think may have overdosed.
I can't believe the Narcan worked and that she was actually overdosing.
It's very difficult sometimes to determine whether or not someone's having an overdose or a heart attack or even a stroke. It's helpful to know that even if you do give the Narcan, however, it won't hurt them, even if they're not having an opioid overdose. And Good Samaritan laws in some states, as well as in Pennsylvania, ensure that any individual who decides to intervene or assist in an overdose is not at fault, nor are they legally in trouble, as long as they do so with good intent. So you did the right thing by administering the Narcan.
How did the Narcan reverse the overdose?
So Narcan nasal spray has a drug inside of it called naloxone. And naloxone acts by kicking off the opioids from the body's cells and reversing the effect it has on the body. And that happens within about 2 to 4 minutes. We also want to make sure that we don't give naloxone in too fast or too quick of a succession. So we have to wait about 5 minutes before we give the next dose. It's also important to know that if a victim gets a dose of Narcan and they use within 30 to 90 minutes, they could then put themselves at risk for having another overdose because the Narcan may have worn off in that time.
What if they don't want to go to the hospital?
They can refuse to go to the hospital, as you saw before, but we're going to try to get them to come with us. Victims react to overdoses, after overdoses, in all kinds of ways, sometimes with sadness, anger, confusion, but we just want to make sure that they're all okay.
Once they're at the hospital, are there other ways to help them?
We have lots of resources to help them with treatment, and if they would like, there is an opportunity for recovery.
It's amazing. How could someone like me get Narcan in case this happens again?
In Pennsylvania, you can get Narcan from any pharmacist without an individual prescription. Right? Okay, I'm going to get into the van and take our victim to the hospital. Thank you so much for your help.